Prostate cancer is very common in the United States. It's the most common non-skin cancer, and it's the second leading cause of cancer death among men.
Symptoms of prostate cancer are typically not there.
If you're not getting checked, you're not going to find it.
American Urological Association recommends that we start prostate cancer screening in the early 50s.
Prostate cancer screening occurs most commonly in two ways. One way is with a blood test called the PSA test, or prostate specific antigen. Another way is with a rectal examination. You may see it abbreviated as DRE, or digital rectal examination.
Once we started instituting PSA testing, the death rate from prostate cancer clearly has come down.
We're in an exciting era in that we're able to add things like MRIs to the prostate, and there are genetics testing that we can do on men as well that we couldn't offer in the recent past.
Right now, when someone's diagnosed with prostate cancer, the first thing we do is we look at the pathology report, where the pathologist looks under the microscope and gives us a scoring system. And that gives us a very accurate representation of how aggressive the cancer is.
The worse the cancer looks under the microscope, the worse it tends to behave.
The second part is we look at the patient. Is the patient healthy? How old are they? What is their life expectancy? And we take all these factors into consideration. We sit down, we have a conversation, usually with the patient and their significant other and sometimes other family members, and we come up with a rational decision what we should do with that patient and what we should do with their disease. And that can change over time.
One of the first things I say is, I'm glad we found out. And had we not looked, we would never have caught this at the point that we did.
It's very, very common to speak to a patient and tell them, yes, you have prostate cancer, and that's unfortunate, but you don't need treatment. You don't need surgery, you don't need radiation. Let's just watch it. Certainly there are many prostate cancers that do require treatment. The two gold standards that have emerged are surgery and radiation.
Here at St. Joseph's Hospital, we're very fortunate to be able to offer patients in Syracuse and Central New York the most cutting-edge, modern, and advanced prostate cancer treatments available. We have the Da Vinci Xi robot, which provides the most up-to-date, highly technological, high-definition robot that we're able to use today.
The advance in robotic surgery is that all the mobility is right next to the organ, the prostate, way down in the pelvis. We here at St. Joe's have the longest program of robotic surgery for prostatectomy, well over 10 years at this point. We try to make it as easy as possible for the patient. Typically, the operation is about 1 to 2 hours. Hospitalization typically overnight. Patients do very, very well. Cure rates are extremely high. The other gold standard is radiation.
We're able to offer high doses of radiation to the prostate, which is where the cancer is, to the area we want to treat, while avoiding the side effects of radiation going to the surrounding areas.
The cancer control rates at this point for surgery and for radiation are considered equivalent. Don't be embarrassed to come in for an examination. I think they're more concerned before they come into the visit, and then afterwards they realize, I guess that wasn't too big of a deal.
Movember started for Men's Health Month in the month of November. This is a great time, if you're a man, to go get checked. If you're a woman, it's a great time to bring a loved one, bring him to the doctor and get him checked out.